when we will be not practicing even the transdisciplinary and the multidisciplinary and the interdisciplinary, definitely we will be not able to practice even the inclusivity. So for inclusion is not all about to make them all together, but we have to make them all together. The discipline, even the discipline must, have the same dignity, the same place, the same orientation, the same obligation, the same positionality. So that should be there. So the inclusive teacher education program, so it must be transdisciplinary in nature. It must be multidisciplinary in nature, because each and every teacher must know the biological basis of learning. So the neuroscience basis of learning. So if you will be orienting your students even, so you have to understand कि what biological basis of learning are there. So किस तरीके का नाश्ता करना चाहिए उसे, कौन से time table को कहाँ रखना चाहिए. So all these, the timetable, even the arrangement of the courses, the arrangement of the subjects, the arrangement of the year. So each and every that arrangement had its own biological basis. So the basic knowledge of neuroscience, we have to. So otherwise we cannot be a very inclusive teacher, because so each and every, the autism, the students with autism, the students with hearing impairment, the students with visual impairment, so they have their own mental dynamics in it. So first of all, we have to understand what biological dynamics are there. So without understanding their biological domain and dimensions, we cannot include them. Otherwise, it will be very frustrating to them even. So we are just inviting them and we are ignoring them. So just this kind of orientation that should be there. So that's why. So transdisciplinarity and multidisciplinarity of in-service or the pre-service teacher education program, that should be there. Otherwise, so we will be not able to practice the in true sense inclusivity. So this
Sir,
is
actually what I feel, even research training module also need to be said.
Yes.
We are focusing only more on identification in which level. Leveling the child is more, like we are giving more emphasis on leveling the child, not the what is the learning problem of the child. So actually teachers should give importance what is the learning need or learning style, or what is the biological need of his learning knowledge. But we are focusing on this is hearing impaired, this is visually impaired, this is learning disability, this is that. So we are focusing more on identification and screening, not the teaching strategy and method.
It's a really very good remarks even. So just even in the name of disability, just we have made a very tight compartment.
Yes.
Very tight compartment. Compartment of hearing impairment, compartment of visual impairment, compartment of learning disability, compartment of but ultimately he is a learner.
Yes.
He might be facing the problem related with gender, problem related with the disability, problem related with the autism, might be the HI people might be having the autism difficulties. So that severe compartmentalization has made this problem more complex.
Yes.
And that leveling, just you understand, after, because in 2016 we have got our PWT.
Yeah.
But still, we are not able to even make our own screening checklist as per the disability or as per the cross disability. Because just still we are using the census up to 2011.
Yeah.
So just if you will be, making the screening checklist to understand the disability, particularly disability as a social construct, not as a biological construct.
Or medical construct.
So of course, as a social construct, then of course the Assamese, the level of intelligence when you will be deciding and when you will be putting the level.
Yeah.
So in Assamese, you must have that intelligence assessment tool.
Yes, but we do not have.
Because still we are using the Westler's intelligence
Yeah,
scale.
Western.
So this is very ridiculous. So sometimes we are assessing, we are checking, we are just analyzing our learners.
Yeah.
Suppose that tribal
It's like
students are
Western.
there and they are not knowing that what kind of the items has been put into that vessels scale. So on the basis of that, just we are scrutinizing, we are leveling them, and we are making their life troublesome.
Yes.
So this is very important. So first of all, just if you will be seeing that, identify the learning needs of the student. This is the second guideline. So first of all, we have to understand the very philosophy of inclusion as per your requirement, as per your need, and then identify the learning needs of students arising due to disabilities. And the contextual part, particularly the social, cultural and economic disadvantages, understanding the significance of a screening of children with respect to disabilities. So, sensitizing the teachers for conducting the screening procedures. So, particularly in case of children with disabilities, so we have to understand the social construct of disability. So, just we do only on the basis of psychology and the standardized scale of the intelligence, the standardized scale of the kind of for the dyslexic people, the dysgraphic people, just we use the standardized too. But when you make it more standardized, it is more rigid. There is no scope of making it, putting the local context in it. So this is very important domain even. So being a teacher and at the state level and at the cultural the groups level, basically we have to develop our own screening tool, and then we have to level the learners and then we have to put into the particular category. So the categorization is not important. Understanding the learner, understanding the background of the learner in socio-cultural context, that is very important. So that's why it must be the part and parcel of the teacher training program.
So do we have a standardized tool for which is...
No, we do not have local context. We are using the American
I'm
one.
talking about India, rest of India, ASIM does not have. But I'm asking, so if you have a standardized tool which is specific to a state or a locality in our country, I'm just asking a question.
Yes. So first of all, that's why I'm asking.
Yeah.
So through the Wessler's intelligence scale, no, we don't have.
That's
No,
what we do
don't
not
have.
have. That's what I'm telling
None
you.
of the states we don't have. None of the...
That's why, yes.
Yeah,
So basically the SCRT
we are
has to
using
take the
the-
lead of that.
Yes.
So the SCRT, in the particular the NCRT, the state level
Yes, that's
and
what
the cultural level, we have to take the lead
That's what
of.
I'm telling.
So otherwise, through that standardized test, we cannot assess the learner and we cannot putting them into the particular category. So this is a completely injustice to them. When you are just, without understanding their socio-cultural background, you are putting them into the category, you are leveling at a discriminatory note. So that discrimination must be avoided. So that you cannot be very equitable.
We are thinking of more than crores of children by initiating national curriculum framework or other thing. So, and disabled children it will be lakhs, like 10 lakhs or 15 lakhs or something like that. So definitely we can think of like a specific guideline or specific checklist at the national level, and at the local context they can be
Yes, that can be contextualized.
yes, contextualized, or it can be converted to the local language, or everyone can
True.
use it.
So Bharatiya Bhasha Samiti is doing very wonderful work in, but exactly we are not finding even the local level experts in.
Yes.
So first of all, for the expert orientation, but because Bharatiya Bhasha Samiti in various languages, the Assamese, the Bengali, the Maithili, the Bhojpuri, many languages they are working on. But it's very difficult to find the experts even. So who would be working in that local language? Because the language, English language and the Hindi language and the very standard language, we are using it, and we are just killing the local veracity. So this is very bad thing, and for a country like India, so just we have to understand what could be the actual and appropriate model of scrutinizing, and what would be the actual model of the assessing the students, where the country is very vast, and at the national level, just we can put the guidelines. But that guidance cannot be implemented
By oneself.
letter to letter and words to word. So this is very important.